job hunting is very difficult, as you know, in Australia, being an international graduate.
Okay, hello everyone and welcome back to the Career Doctor channel. Today I'm very excited for interviewing yet another international doctor who has managed to make it through the process here in terms of being able to work as a doctor in Australia. So I'd like to welcome Noty, who's currently working in northern New South Wales in a rehab job and is going through his provisional registration year. And Noty and I have been in a bit of contact for a while now through, I think, mainly the Facebook group that we run. Anyway, welcome this evening, Noty. Thanks for joining us.
Oh, thank you, Anthony, for inviting me for an interview.
You're welcome. Hopefully this won't be as stressful as the one you did for your recent job. So, Noty, you're working in northern New South Wales, but can you tell us a little bit more about the job you're currently doing? What does it involve?
Mm-hmm. So I currently work in a rehab department. It's a 19-bed capacity in a rural setting. But yeah, so this is my first job in Australia. Thankfully, I got it. Just a little bit of background of the ward, subacute ward. I work under a consultant, a rehabilitation consultant. So basically, after the acute phase, we see patients, and usually we do the rehabilitation process. And after that, sometimes manage acute medicine, but essentially it's a rehab ward. Yeah.
Okay. And how long have you been doing that for now?
A couple of months now. I think 7 months already. Yeah.
Okay, great. And tell us a little bit then about your background. Where are you from? How long have you been in Australia?
I've been in Australia maybe 3 years in and out. Originally came from the Philippines. Graduated in the Philippines 2015. After that, I did my AMC exams through the standard pathway. Took me maybe 6 months again to complete all these process of all these examinations. And then, job hunting is very difficult, as you know, in Australia, being an international graduate with no strong experience or a background to show for in my CV. So I did a lot of things to strengthen my CV through your help, thankfully.
Mm-hmm.
And also did a couple of serviceships through a GP and also through in Melbourne in Northern Hospital, which was very helpful. Yeah.
Great. And so, had you been working for a while in the Philippines first? How long have you been working as a doctor all up?
Oh yeah. In the process of your job applications, you have to dig deep and do an introspection with yourself. What are your weaknesses and your strengths? I reckon my weakness really when I was applying in Australia is that I only had internship experience and only a couple of months as a locum HMO or an RMO, as what you call it, in a large hospital in the Philippines. So I knew from the start that I am at a disadvantage of applying for jobs because my experience really isn't that strong.
Mm-hmm.
So, but I did all these exams, just banking on, if I pass all these, the AMC certificate, essentially, I would try to apply for a job, which I got, thankfully. Yeah.
Great. And one of the questions I often get from IMGs is how long does it normally take to get a job? How long was it in your case?
Yeah, for me, because I passed my first step right during the internship year, and then I did prepare for another 3 months for my clinical exams. After my clinical exams, I found a job 6 months after.
Okay, so you were kind of looking for maybe about 12 months.
Yep.
Started in your internship and kind of got a job reasonably quickly after doing the clinicals, which is yeah, so that's relatively quick. So congratulations.
That's relatively quick. Yeah.
Now there is some advantage to doing this AMC process fresh out of medical school. Did you find that? Did you find sitting the MCQs and that sort of stuff easier because you'd recently graduated?
Oh, definitely. Yeah, and because I like to study and I want to do things in a planned way So definitely right after internship, I studied for the MCQ, and then after my what you call it, professional license in the Philippines, I did some clinical study again to prepare for the clinical exam. So essentially, I was trying to prepare for it, and I acted as if it's my last exam.
Yeah, and so it sounds like it was a bit of a plan through medical school to also then try the AMC process. Why did you want to work in Australia? Was there a specific reason?
Oh yeah, definitely, because my partner is in Australia in the first place.
Yeah.
Yeah, so she was here and I was in the Philippines doing medical school, and there's little information before when I was reading about Australia, so I had to dig I had to do my research about the AMC process, and I think it takes a lot of time to plan, and it takes a lot of courage to just to jump onto it.
Mm, mm. So that's kind of a common thing that people have relationships with Australians, and
Yeah.
spurs them on to go
She's
through
Filipino though. She's not Australian.
that. So, yeah, so you had a bit of a plan even through medical school, and you mentioned that it was very hard to work out the process. What bits were hard? That what was difficult to understand?
I think, yeah, because the thing that was hard for me is that, but the AMC process itself, they laid out the website beautifully. I think it's understandable. I think the difficult part is the process itself. When you pass through the exams, you don't know how to get a job, and or even the chances of getting into the jobs.
Mm.
Information for me is lacking because I don't have a good data to look on and to base my decisions on when I considered Australia in itself. So looking back, I thought that the chances were slim, and um, and also I knew from the start that the experience in application plays a big role in finding a job here in Australia. So yeah, I think that's the hardest part, just knowing, or the uncertainty of getting a job, really, I think was the hardest.
Yeah, I think that's a good point. That if you're going to go through the AMC process, then you also need to think about the strengthening your application as a job candidate, because as you said, it's hard to get accurate data about how many doctors are applying for jobs, particularly through the standard pathway process. We know a few things about visas, and how many people get registered through the various registration paths, but it is hard to be sort of clear about how many jobs there are advertised and how many people are applying for them.
This is very confusing for me, or a paradox in itself. When you say that you cannot be registered before working, and you can find work without any registration, I think that's the greatest.
Yeah, it must seem like a catch-22 situation. Yeah, it's people. It's very hard to explain that. I'm often giving advice to people. Start looking for a job as soon as possible. Start looking for a job as soon as possible, because they won't register you until you've got a job. And so a lot of people go, they put their heart and soul into the AMC process, and they get the part one and even the certificate, and then they don't realise that that's all redundant unless they get a position and they can convince someone that they're good enough to work in that post.
And then you get a gap year again. You don't work for 3 years working for a job here, and then you have to go back overseas to have recency of practice. I think that's the hardest part, being invested in all these exams, and you don't get a job, and then when you have a job, and then APRA stops you because you don't have recency of practice, and then that's another issue to address on. So.
Yeah, absolutely. Yeah, the recency of practice is another thing that needs some explaining, and I intend to do a video about that at some point shortly. So you went through the standard pathway process, and you mentioned one of the hardest parts was sort of not so much understanding what you needed to do for the AMC exams, but the bits around registering and finding jobs and who you could work for, I guess. Out of the two exams, which was harder, do you think?
Oh, definitely the clinical exam. And all the IMGs will say the clinical exam in itself I think it's one of the hardest. And I think you have to be very prepared. And, even though though if you're very prepared, there's still very many variables that you have to deal with during the exam. And I think it's just combination of everything, preparation and some luck.
Yeah, yeah. And how did you go about preparing for that? What was your process?
Yeah, I did. I did everything. I applied. I did the bridging course by EEL. I think that was very helpful because back home in the Philippines, we don't really focus more on the OSCEs and all these clinical type exams. So I know from the beginning that it's going to be my weakness. And also after that, I had several partners to do some study after the bridging course, essentially. Yeah.
Yeah, a lot of people seem to do what's called recalls. Is that what you did?
Yeah, recalls is good. Recalls, it can kind of gives you an idea of what to prepare on. But yeah, there are some twists and turns in the actual exam settings, and it will get you off guard if you don't prepare for it.
Yeah, so for those people who aren't familiar with the term, for both the part one and the part two, if you're in any like Facebook groups or communities or whatever, people will be talking about the recalls. So what happens is after every exam, the people who've just sat the exam try to remember all the questions and then people try to study against them. And I think, well, even with the MCQs, I observed some funny things, but I think with the MCQs, it's probably a bit easy to be accurate maybe around some of those questions. But even then, you sometimes observe that some of the answers seem to have been translated a little bit weirdly. So you have to be cautious a little bit about those. But then with the clinicals, again, people try to like reconstruct the clinical station. And the stations are, they call them clinical stations, but they're pretty much OSCEs from what everyone else talks about. So again, it's a bit hard to remember everything in an OSCE. And also, you don't know what the rubric is. So you don't know if you say something differently, if the actor or the examiner is going to react in a different way. So it's a little bit harder to reconstruct, isn't it?
And sometimes I think they say it's very objective to grade the clinical stations, but
yeah.
I compare myself to the other candidates who did the station really well, and I thought I really did very badly.
Yeah.
But I passed the station and they failed the station, and I just don't understand sometimes, the grading of it.
Yeah, I think generally people are fairly poor at self-rating in an exam setting. You're too anxious to, so that experience of feeling like you've done badly and then doing well is not uncommon. Okay, so so study groups, doing a few bridging courses. Did you do any of your observerships before the clinicals, or did you do them after?
Yeah, I did that after clinicals. I've heard about this observership stint in Melbourne. They said, it gets you to an interview stage because I was desperate. I couldn't really get into the interview stage after applications. And I've said to my partner and to my wife, I'm just going to try this observership stint in Melbourne. And maybe I will get an interview. Fair enough. They gave me an interview after my stint there, and they gave me really good experience there. Really good teaching. I love that hospital. Yeah.
Okay. That's one of the formal observerships that are available in Australia. In fact, it's the only one I know of that has kind of a regular expression of interest process. It's a Northern Health in Melbourne, and I think they have a regular intake. You generally have to have the AMC certificate to be eligible. And as Noty says, there's probably, I often get a bit conflicted as to whether people should do observerships or not. I think they're helpful, but they don't replace clinical experience particularly. So I think the two reasons they're helpful is they may help you to be more familiar with what's required in the Australian hospital environment and how teams work and all that sort of stuff. So again, it could actually prepare you for the clinicals and things like that. But also it enables you to kind of be tested out by potential future employers and, develop some relationships with that hospital, or potentially sometimes if that hospital feels that you've done a good job but they don't have a spot for you, they might recommend you to another hospital that they've got a relationship with. So it kind of gives you some personal contacts that can be really helpful in getting a job.
I had a good rep for you, with them. Yeah.
Yeah. And so do you think that was the reason you ended up getting the job in Northern New South Wales, or?
Not really. I think it just made me more aware of what to expect in an actual workplace, documentation wise, and how to present the case to the consultants. I think that's the most important thing there. And also, I've tried calling in the observership setting. It's very daunting at first when you are calling other people from the end of the phone, and I think that's helped me a little bit. Yeah.
So at the start of the interview, you were saying that you recognise there are a lot of deficiencies in your in your CV when you started this journey, like you're actually still doing your internship, and that you'd worked on strengthening some of them. So what things did you work on strengthening in your CV or resume?
Yeah, out of desperation again, Anthony, I stumbled upon you in one of your YouTube videos.
Right.
How to build your resume. I watched all those episodes.
Link in the description below.
Yes, in the description below. And you actually talked about how to present your CV, and you also talked about putting all those in the first pages, the most important things to highlight your skills. And after that, I just edit crazily my resume after that, and just intently followed your guidelines. And yeah, I think coincidentally, I found some interviews after that one.
Yeah, well, there's an association. I can't claim causality, but yeah, look, I think some of it's about persistence. I do think that the CV, which is actually more of a resume, by the way, I think that's one mistake people make, particularly from Asian countries, where the CV expected can be several pages long. Here in Australia, we do want something reasonably short and to the point. If you know what should go on that first page to kind of partly stand out, but also make the job of the employer easier by saying, yes, they meet the criteria, no, they don't, I can move on. I think that's very crucial, because sometimes you make a personal connection, but often you're just blind emailing people or filling in applications, and literally people are spending a few seconds looking at one CV and then moving on. So if it doesn't stand out, if it doesn't do the job, then you've probably missed out an opportunity. Yeah.
I think that's the most important lesson that I learned from all these job hunting.
Yeah.
And validated by the AMA support group that I am into now. She helped me with my CV, and she said, "Oh yeah, just this format was basically the one you suggested." Yeah, so I think it's a validation.
Yeah, great. So yeah, look, if people are looking for guidance, there's things on my website, there's things on the channel, we have courses, all that sort of stuff. But yeah, it's worth investing time in that document, getting it right, even spending a few dollars getting someone to help you if you're not sure what you should be doing, because it can be the only thing that kind of is that connection between you and the prospective employer. Now, its job is to get you the interview, but then you've got to pass the interview. So that's the next part in the process. So how many interviews all up have you had?
I think I had 5 interviews.
Yep.
4 or 5, I think. Yeah. The one that I got first was the Northern Hospital in Melbourne. They did interview me for the observership. It acted like a real job interview. So they asked me a lot of clinical questions, and the one that caught me off guard was the ethical questions. I think I think it's one of the questions that really will make the IMGs think more, or I think it's making them unprepared. Yeah. I learned a lot from the interviews that I had, even though some of them are not successful.
And so you got a bit thrown off with that question, but you got the observership. What sort of questions have you ended up being given in interviews? Are they similar, or do they change a lot from job to job?
For some other hospitals, they didn't really ask for similar ethical questions. But the one that really it's stuck in my mind right now is just I was presented with a patient, 85-year-old lady who came to the ED presenting with syncope and looking like a ruptured aneurysm, and they asked me what to do next, and they said, "Oh yeah, so you did all these primary survey and you stabilized the patient, and what happens when the patient decompensates or when there was cardiac arrest?" So I didn't really ask about, the advanced care like support, advanced care life plans, or the, all these documentation you have to ask for from this patient. So I recommended, she needs to go to the OR for urgent surgery. But right after that, the consultant told me that she has an advanced life care plan, and she's not resuscitation, and you just you just sent her to the OR with no other,
Mm.
the ethical considerations. You have to consider all these
Mm.
advanced directives before you decide on what to do next. Essentially,
Mm. Mm. Yeah,
that
yeah.
was the question. Yeah.
Yeah, that's a bit of a twist on a question. Yeah, and again, things that may not be the same in other countries, that it helps to do an observership, get some experience, be in networks of actual doctors that are working here can really help you to sort of understand some of those nuances. Often with those clinical scenarios or the hypothetical clinical scenario, they're also looking for you to talk about when you might get help from someone else as well.
Oh yeah, yeah.
Yeah. Other sorts of questions you've been asked in interview?
Yeah, also, I think there was a particular scenario that this patient was presenting with hypotension. Apparently, he's in an acute kidney injury, and what would you do? Uh, but during those questions, I really just based it from my own experience in internship. Really didn't know how to approach the patient, a deteriorating patient in particular. But looking back, if I had done this detect course and all these courses here in the hospital that was taught to me, I could have done it better. Maybe do the ABCDEF approach, which was very helpful. If you see a patient in the ward, you better make sure that you do a survey then, and if you can do something to stabilize the patient, and then look at the chart, and then buy some time, and then ask for help from the seniors. I think that's the general flow that they want to hear.
Yeah. So invariably in every resident level interview, there's a clinical scenario, and obviously you can't know all medicine. So there's possibly the scenario is going to be something that's familiar to you or less familiar to you. But usually there's a few indicators in the scenario that, as Noty says, the patient is in a bit of a situation where they're either it's just a straight out what we call a MET call, a REST call, emergency response call, code blue, whatever you want to call it, or that the patient is deteriorating and you need to get some extra assistance in. So they're not necessarily going to not hire you if you don't know the causes of hypotension related to kidney damage or anything like that. But they want to see, as Noty says, that you can be calm, methodical, do some things to stabilise the situation, call for help to get the situation sorted out. Also, not forgetting that often you might be the only doctor at the bedside, but there's usually other resources available to you. So often you don't hear, when I'm out doing interviews, you don't hear the applicants talk about, well, this is what I would ask from the nursing staff. So thinking about also the fact that you've got other colleagues there that can help you out as well, often very experienced. Yeah.
I think that's a highlight of what they were asking for. Working in a multidisciplinary team. I think if you involve the nursing team and other teams, other members in the healthcare team, will be very good in the interview.
Yeah, and often on these interview panels, at this level, there's usually like a nurse unit manager or some sort of non-doctor who. I mean, doctors are also, do value the multidisciplinary team or the interprofessional team, but if you can demonstrate to the non-doctors on the panel that you've got respect for other people who work in hospitals, that's going to really help you out as well. Because one of the sort of red flags is doctors who don't get on well with the rest of the team, or stay very medical in their focus and can't form relationships with nursing staff and allied health staff and the ward clerks and the managers, etc. So any sort of indication that you might not be a team player usually ends up with the panel deciding, no, we're not going to take a risk on this person.
Yep. I think that's coming from a country that you have some paternalistic behavior from a doctor, and and judging from Australia, you don't get that here. You're basically just a team member in a very wide workforce. It's just you're just playing your part, and everyone is just also there to play their part, and there's no one really dominant in the clinical setting. I
Yeah.
think Australia, I can compare that to my country, because when you see a doctor there, you can just command everyone to do something for you. But in here, you have to do stuff too.
Yeah, so health's a real team game here in Australia. And yeah, that is one of the things that some doctors transition well into and others not so well. I think, unfortunately for some experienced doctors, we're now talking maybe at the specialist level, who are from some of those sort of countries that Noty describes in terms of the healthcare system being very hierarchical. They do struggle because you'll literally be on the ward and there'll be a 30-year-old female nurse unit manager being very strong in their opinions of what should happen. And if you're not used to having that sort of dialogue going on, it can be very confronting. You can adjust to it, but you need to be prepared for the democratic process that we have here in Australia in hospitals. And I think that's good for patient care, that everyone can have their say and their opinion. You mentioned that one of the things you did was really overhaul your CV. In terms of approaching employers, have you got any tips for people about how to do that?
Oh yeah, I'm a really shy person. I did try to approach some of the managers, the JMO managers. You get shunned a couple of times, and emails, they don't respond to you. But I think persistence is the key.
Yeah.
Some of them are really good, and some of them really respond to you and lead you to other people who might need you. And so that you just take it by the day and just be persistent.
Yeah, and you've ended up getting a job in a regional part of Australia, which is one of my tips. Think outside the main capital cities, because usually you get a bit more of a personal response when you send a CV through or show interest. Is that your experience?
No, I applied through the campaigns
Okay.
last year, but the other ones I did contact them personally.
Yeah.
Their websites, so they've got some email addresses there, and just attach my CV and attach a cover letter.
Yeah.
And, just be respectful and be professional with your email. I think they will respond.
Yeah, not everyone's going to respond. They do get lots of emails, and if you're looking for a response, make sure you actually take the time to write. I wouldn't write a long email. I wouldn't even write a cover letter. I just attach a CV, write a short email saying that you're interested in, and make sure you get the position and where it's at, and maybe something that shows you've actually researched it, because there is a bit of a habit of everyone just basically getting a long list of employers and blind copying an email. Whenever I used to get one of them, that would be straight into the spam file, basically. Yeah, so show a bit of respect. You're still probably not going to get a great response rate, but you're more likely to get a few nibbles. And what it might just do is the people might hold on to your CV and say, yeah, I think this person's okay, worth considering if there's a job. And then maybe when the campaign comes around, you've made that impression already, and so it gets you to the interview stage. And then, as Noty said, you've got to then nail the interview as well. And so you've got your job and it's going well.
Oh yeah, it's going well. I'm gonna have maybe a rotation with the medical ward. Hopefully, I get that.
Yeah.
But definitely, I'm looking into the rehab pathway, but I can't get into the next step because I don't have the general registration yet. So maybe I'll try to find junior positions for the next year.
Yeah, and so everyone's focused on getting that job, but when you're in that provisional registration year, it usually goes well, but there are a few things you need to do, don't you? There's supervisor reports, and the medical board likes to see you do certain rotations. Can you just talk us through that?
Yeah, I think we did a couple of reports with my supervisor. That did it ended well. And also talked to my JMO manager for rotations, especially medical and emergency probably. But I'm there's no promise yet, but hopefully I get those rotations.
Yeah. So usually they try to help out. So the goal is to get one of those rotational positions where you get the medicine, surgery, emergency medicine. But if you get an opportunity, grab it. And then usually the hospital can work out some swaps so you can get those core rotations that you need to do from a medical board perspective. And so you're saying your aim is to get your general registration and then look at training in rehab medicine?
Yep, that's a plan.
Yeah. Yeah, so that will be through the College of Physicians, which is one of the bigger colleges here in Australia. It does a bunch of different training programs. It's the main one for internal medicine for adults, but it also looks after paediatrics. And then amongst a number of other programs it does, there's one for rehabilitation medicine. It's got by far the most diverse training number of training programs out of all the colleges. And so the thing is, once you've got your general registration, you can basically apply to become a trainee with the college. They may expect, in someone like Noty's case, maybe another year of experience, but generally you've cleared all the barriers at that point to be able to apply. There's a couple of colleges where you do need to have your permanent residency, College of Surgeons being one of them, and currently for most of the general practice training programs you have to be a permanent resident. But for most colleges, once you've got your general registration, you can apply for training. So you're on exactly the same footing as a doctor in Australia who's gone through medical school and done their also intern provisional year and then got their general registration. So that's another common question I get asked. And just to cap that one off, once you're working like Noty, that sort of starts the clock ticking in terms of being able to apply for permanent residency as well. You get on a visa that once you've been, generally the visa you're on, once after a period of time that can become what's called a permanent visa, and then you can then apply for permanent residency. So it's a bit of a pathway to permanent residency and ultimately Australian citizenship if that's what you're after, would like to do. So yeah, so for those colleges where you have to be a permanent resident, usually once you're working as a doctor, there's a pathway to becoming one. And so why rehab medicine?
Always interested in physical medicine. I'm into sports, and it's always fascinating to see, in my perspective before, always to see an athlete recovering from an injury. But now my perspective is widened. Stroke patients, spinal injuries, and all these sorts of stuff. It is interesting, and it keeps me curious. So I think it's a good specialty to focus on in the future.
Great. And you mentioned you watched the video about the CV. I was just wondering, what was the most helpful video or blog post that you saw from Advanced Med or the Career Doctor?
Yeah, so it was that video. I think it's one of your earliest videos that you posted on, and I just looked at the video. The content was really helpful, and it's really relevant. All these, your stuff basically. You're speaking all of this, the pathway, and you're giving us tips to focus on, and really I think. What of all the doctors or all the people who try to help other doctors, I think yours is the most relevant in all honesty and all objectivity. Yeah.
Thank you. Humbled. Yeah, well, thank you very much for agreeing to interview tonight. And I'm glad that you're doing so well. And the take-home messages, I think there's a number. One is you can start working towards the AMC in your internship. So think about doing it early because it may be helpful because your medical knowledge is still there. Don't get put off that your level of experience might be a bit of a barrier. Put a lot of effort into that clinical because it is hard, and be persistent. In Noty's case, he had a fairly quick trajectory to a job, but he did have to put in a lot of applications. He did have to go through 2 observerships, and he sat through 5 interviews before he was successful. So, and he had to really overhaul his CV as well. So persist, but be prepared to change strategy as well. Keep working on improving your candidacy. Yeah. So any final thoughts for the viewers?
Yeah, for everyone who's contemplating to have a job in Australia as a doctor, it's not going to be easy, as what Anthony said to you a couple of videos more. And it's the recipe for success is not a secret. It's always through hard work, combination of all hard work and luck and everything in between. And everyone has been helpful so far, including Anthony. I just want to thank my family also, my wife, and everyone who supported me throughout this journey. And the journey never stops and learning never stops.
Absolutely, and I look forward to hearing about how you go on your journey.
Yes, thank you, Anthony.
Well, thank you very much.